Hello everybody and welcome to Species Specifics. Today we're going to be discussing ferrets. If you are new to this series, the goal of these lectures is to cover unique diseases of the different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I've also included some diseases that are not mentioned specifically in that guide, but may come up as you're taking your NAVLE. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic tests. I've also highlighted key, easily recognizable characteristics of each disease in purple. For our ferrets, we're going to start with our viral diseases. Elution disease is a parvovirus that causes immune complex deposition in multiple organs. Clinical signs include weight loss, hepatomegaly, splenomegaly, and lymphadenopathy. You can see the enlarged lymph nodes in this image, for example. Treatment for this disease involves anti-inflammatories and immunosuppressants. Note that there is no vaccine available for this condition. Ferrets are highly susceptible to canine distemper virus. The major clinical feature is hyperkeratosis, or crusting, of the face and the foot pads. You can also see nasal and ocular discharge. There is no real treatment for this condition, as mortality is close to 100% in ferrets, and so for this reason, vaccination against canine distemper is recommended for all pet ferrets. Influenza virus can appear similar to early-stage distemper, as it also has fever, nasal discharge, and sneezing. It's important to note that influenza in ferrets can transmit between the ferret and the human, and vice versa, so you have to be careful about biosecurity when handling these influenza ferrets. Treatment for this condition involves supportive care. Epizootic catarrhal enteritis is caused by ferret enteric coronavirus. This virus causes severe enteritis with malabsorption and maldigestion. It produces a characteristic green or mucoid diarrhea, as well as vomiting and weight loss. Treatment involves supportive care, and it is important to quarantine any new ferrets that are entering a colony as a preventative measure against this virus. Finally, we have ferret infectious peritonitis. This is caused by a ferret systemic coronavirus. It causes a very similar disease to the dry form of feline infectious peritonitis. Like the cat virus, it primarily affects young animals. Clinical signs include diarrhea and enlarged lymph nodes. There is a poor prognosis for survival with this condition. Now we will look at two bacterial diseases. Helicobacter gastroenteritis in ferrets is caused by Helicobacter mustelae. This infection results in gastritis and gastric ulcer formation, similar to Helicobacter infections that occur in humans. This is particularly notable because gastric ulcers in other veterinary species are not associated with Helicobacter. Clinical signs include vomiting, diarrhea, melena, and weight loss. Treatment involves antibiotics and omeprazole. Proliferative colitis is caused by Lawsonia intracellularis and results in hypertrophy of the intestinal mucosa. This disease primarily affects young ferrets. The most recognizable clinical feature of this condition is rectal prolapse, but affected animals also have diarrhea. Treatment typically involves antibiotics and management changes to reduce exposure to the bacterium. Ferrets also have a couple of unique endocrine diseases that we should mention. First off, hyperadrenocorticism in ferrets is different than in other species, as it results in proliferation of the zona reticularis, which is the part of the cortex that produces androgens. This results in androgen toxicity with signs like alopecia, swollen vulvas, and pruritus. You can diagnose this condition by identifying enlargement of the adrenal glands on ultrasound. Treatment involves surgical removal of the adrenal gland or deslorelin implants to help control hormone levels. Ferrets can also develop estrogen toxicity if they are unbred. This is because intact female ferrets have about a 50% chance of remaining in heat if they are not bred during their normal cycle, which results in continuous production of high levels of estrogen. This estrogen suppresses the bone marrow, resulting in reduced platelet and red blood cell formation. Clinical signs include bruised skin, swollen vulvas, and melena. To prevent this condition, spaying female ferrets is highly recommended. Finally, ferrets commonly develop insulinomas, which is a bit strange compared to our other veterinary species. These are functional tumors of pancreatic beta cells, resulting in a massive release of insulin. Clinical signs are related to hypoglycemia and include stargazing, weakness in the hind limbs, and seizures. Clinical signs often resolve after the ferret eats a meal because that increases their glycemic level in their bloodstream. On diagnostics, you will notice the characteristic hypoglycemia. Treatment involves surgical removal of the tumor or corticosteroids. Finally, we have a couple other odds and ends to discuss. Heartworm or Dirofilaria immitis can affect ferrets. It typically results in signs of right-sided heart failure like coughing, dyspnea, and ascites. It is usually difficult to diagnose in ferrets because they usually only host about 1 to 20 worms, but because of the ferret's small size, those worms can cause significant cardiovascular effects. Treatment involves adulticides that target those worms, and ferrets should also undergo echocardiography to identify right-sided heart failure for treatment for that as well. Chordomas are a common tumor in ferrets that arise from the notochord, which is an embryonic structure found near the spine. These tumors appear as firm masses on the tail. They are easily treated through surgical removal. Finally, we have dilated cardiomyopathy. This is the most common cardiac disease in ferrets. Clinical signs include dyspnea, coughing, and ascites, and you can diagnose this condition through echocardiography. Treatment is similar to other species, involving a combination of furosemide, pimobendan, and enalapril. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and share with your classmates. Thanks again for watching, and we will see you in the next video.